It's very swollen now, sorry.
Um, uh, so anybody that's a Mount Sinai patient that needs to be admitted will be admitted within the Mount Sinai health system. And we know that we have capacity to treat all of our patients. So that's how we would make that decision whether we should expand beds or not. So at this point, it doesn't look like we need to, but when we convert our psychiatric emergency room into a CPEP, we may get more volume, and then of course we'll have to see what we do. But again, because we are the system, we can move patients to another hospital if need be, so that they can have. Okay.
Normal question. You have the mobile crisis unit. Is that the EMS units that run out of your emergency room, or is that a separate unit?
That's
They're trained different?
Yeah, it's not an EMS unit. That's a separate unit that runs out of the emergency room. They don't get 911 calls. So they work with NYC Well. If somebody is in crisis, then the team can go out into the community and see the person, do an assessment. And sometimes they will go there, and then 911 also shows up for whatever reason, so they can actually help work with 911 to try to make sure that the person gets what they need and is not just automatically transported somewhere in handcuffs, for instance. So it's a separate service that is connected to our emergency room, not 911 or EMS.
Okay, and the insurance, I suppose it says uninsured. Is there anybody in the emergency room that is qualified to register these people for affordable health care as they're being treated in case they don't have?
So they can get emergency Medicaid, for instance, they will help them get that.
Our social work teams do that. And again, honestly, I think, I'm corrected, when someone's in the emergency room, the first priority, regardless of their ability to pay, is giving them the clinical care that they need. Once that's done, that's when we would focus on that. But we do not have somebody go while somebody's sitting, in their bed and saying, do you want to sign up for Medicaid? Because our responsibility is to provide the care first. And that's secondary, but we do have a team that does that.
Great, thank you.
Sure. Any other questions?
So yeah, what's up there?
Yes.
There's more? Thank you.
I'll go really quickly, okay? So just to talk about the Harlem Health Center, it's on 124th Street. Next slide, please. It's a multidisciplinary healthcare facility. So it's not just behavioral health, but it also has primary care and other specialty clinics like you see, pulmonology, podiatry, etc. And the psychiatric services that they do have there is really for adult, for a child. They also have the intensive outpatient program, which we will be building at Mount Sinai Hospital. They also have what's called a partial hospital program. Those are also different levels of intensity. And a very unique program called CITPD. It's the Center for Intensive Treatment of Personality Disorders. And again, same situation. We take most insurances. They have a higher volume, 30,000. So it's a larger program than the one at Mount Sinai Hospital. Adults, children, and again, the whole gamut of services that they provide there. Next. And last, just real quickly, at Morningside and the opiate treatment programs. Next slide. Those are not connected. I know they're on the same slide. So at Morningside Hospital, I just wanted to highlight. So they also have inpatient services there, adult, geriatric, but also a child and adolescent inpatient unit. And they have a CPEP, so the more comprehensive version of the emergency room there as well. So at Morningside, the former St. Luke's, they have the inpatient service with the emergency room, and at Harlem Health Center, they have the outpatient services. And then last but not least, the opiate treatment programs that Brad was referring to earlier. We have one on 125th Street on the east side, and then one on the west, 125th Street. And the volume is about 180,000. But again, that's come down drastically, and it comes down every single year for the reasons that Brad. And I think that's it. Okay, more questions?
Online, Robin, okay, I'm gonna ask a question. Mental health to me is a big issue in our city, in the country, obviously. And I wanted to know, I just had this conversation with someone yesterday. How often can courts, legal system, mandate for medication? Because I think a lot of these crimes, the one you mentioned first was somebody that was actually in my residence who came to Mount Sinai. So that hit home for me because he was in the elevator with a weapon. So that really hit home. But how can we, what systems are in place to mandate people with mental health issues, severe, obviously, to like take medication? Is there an injection? I heard about some injections because the issue is, and so many innocent people, and unless if we're just talking about our city right now, are being victims of abusing, people being abused by people with mental health issues. So is there something in place that they can be mandated by the courts? There's an injection because a lot of the times people are not taking the medication, and that's why you have all of this crime and all of these things. But innocent people are being harmed by these things. So why is it that more prevalent? Mandation of medication, let's get an injection, make sure it's in there for blah 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 days. You don't show up, there's an arrest. That's just my thoughts, and what can happen for that, just to keep innocent people safe.
It's a great question. So there's two things in place, and then you can decide whether that's adequate or not.
Okay.
So there's one is in place for people that are already in the hospital, that are hospitalized. So let's say somebody comes into the hospital because they were, they're not well, they've not taken their medications, and in the process of their psychiatric illness, they become dangerous, and so they're in the hospital. They're saying, "I'm not taking any medication." Right? We cannot force anybody to treatment unless there's an emergency, right? We can't force anybody to treatment without a court order. So there is something in place, though, to get patients treated in the hospital. So I used to work on the inpatient unit, and I did this many times. We go to a mental hygiene court. We ask a judge, you present the case. You ask a judge to order, give us an order that mandates the patient to receive treatment in the hospital. And then yes, if the patient says, "No, I don't want to take this pill," we can give an injection if need be.
Oh, sorry, what's the time frame that it takes for you to get this court order? Because sometimes if it takes months, then.
Yeah, no, it doesn't take months.
I
No,
don't know.
this takes about, I'd say it takes about a week or so,
Okay.
sometimes even less. You have to, fill out some paperwork, and there's court about once a week, and then you can present there. And sometimes it takes a couple of weeks, sometimes the court calendar is very full. And that's something that, we've been working with the courts to make sure that there's enough time for every hospital, because every hospital in the city, that's vying for these court slots. And by the way, with COVID and everything going remote, that's the best thing that ever happened, because now we can just Zoom into court, where we would have to transport the patients. I would spend the whole day in court, and so this has really been a great improvement. So that's for patients in the hospital, and so we do this routinely. Every week, one of our providers is going to court, make sure somebody gets the treatment that they need while they're in the hospital. And that's why there's a court system in place, is because we can't just do this nilly-willy. Yeah, we can't just take patients' rights away. There's a judge, the patient gets a lawyer, and so there's a due process there. The other part of it is for outpatients, patients that are out in the community and that may need treatment, but they're not accepting. So there's something called Kendra's Law, and it's the law that supports what's called AOT, Assisted Outpatient Treatment. So this law is put into place for exactly that reason. Somebody who's dangerous in the community and wasn't keeping up with their outpatient care.
Mm,
So there are certain criteria you have to be, and I don't want to list all of those, but there has to be some dangerousness in a certain amount of time, hospitalizations, et cetera, that qualify you for this, for a provider to apply for a patient to get assigned to mandated outpatient treatment. And once that's done, then there's a court order in place that says this person is mandated to whatever treatment plan you decide. And that can include injectable medications. There are medications that you give once a month. At this point, there's even medications you only have to give once every 3 months. There's even one that just came out every 6 months. So there are ways to treat patients in the outpatient setting, even if they don't like it. But the difference is with outpatients is if they don't comply with their treatment, the consequence is that the providers can send them to the emergency room. That's it. So you can see that doesn't have a lot of teeth.
right.
Right.
So if somebody's like, whatever, I can not take my meds, they'll take me to the emergency room anyway, eventually,
Right.
whether I take my meds, now or later, they might not care. There are other patients that are very afraid of that and will say, oh, I'll take those medications. I don't want to be sent to the hospital again. I don't want to do that. So it really depends on the type of person is how much this law actually can nudge them or force them towards a treatment compliance. But that's out there. It takes a while to apply for that, but we do that also from within the hospital, and it's much harder to do in the community. So when we have the opportunity to do it in the hospital, we do it. But for community providers who want to do that, that's where it can take a couple of months. So there are definitely some challenges. Some things in place, but it's not perfect.
So, thank you.
Yes, from the-
Sure, no, kind of sum up, but yes, I mean, question.
So I was wondering, Mount Sinai has thought about applying for more funding. I know that the governor in New York State, federal, they have for, some self-funding, I saw, and then, I was wondering, and we discussed this with Jewel before, if you need a letter of support from us to help the community in Harlem. To expand, since you mentioned also the CPAP, I thought
Yeah.
there was 200 million that was being allocated for there.
Yeah, and that was actually to construct and we're going to possibly reply, but as I recall, we had already started the work.
Okay.
We missed the window for that one. But what's good to know is when you do apply for funding from time to time, that will come to you from letters of support. I mean, that, I don't know if the next thing that we're going to apply for, but we do apply for one. Possibly.
Yeah, well, when we can, we definitely do. So we appreciate it if you can give us a lot of support.
I have to respond to that, but what's your question about?
Well, okay.
Okay, so yeah, just to kind of sum up everything, we do appreciate you coming out here. Mount Sinai is, is a trusted institution. Brad, I was on the board like 20 years ago, and and we would reach out to Mount Sinai. He would always come with very forthcoming with anything we ask for, your forthcoming information. So we do appreciate you coming out to discuss like the mental health and services within East Harlem. But one thing we did want to end by saying is that what can we do in terms of like any kind of support? I know we asked a lot of questions, but in the end, it's one thing to like barrage and have a barrage of questions. It's another thing to say thank you for coming, and if we can help you in any way, we're happy to provide a little support or anything else in terms from outside.
I think that, and then in the ongoing dialogue, because a lot of these issues are really complicated, and, we need your thoughts or input. So the dialogue, I think, is really helpful, and especially when we talk about, I think of the O2P programs, that, in your dialogue and stuff on that.
Okay. So thank you both very much.
Our pleasure. Yeah,
You're
thank
very
you for
busy.
having us.
Thank you for coming out. I think very busy. You both been very busy. Thank you very, very much.
Thank you.
We'll see you.
Thank you for the game.
All right.
Thank you, guys.
everybody.
Thank you. Nine comes at 8:30. So just as you all know, so, you know, Ad and I met, and to like go over some questions, so we had some stuff that we wanted to.
Prepared.
To prepare, so that's why and I really wanted to like put stuff out at them, what happened at Bellevue and what happened, so anyway, but, let's move on, so thank you, and the plan is to hear from other entities within East Harlem. So the plan is to reach out to Metropolitan Hospital, but Mount Sinai is first, I guess it will happen in the fall. But they're from Metropolitan, Harlem Hospital, possibly even Henry J. Carter in terms of their mental health services, in terms of the resources, and in terms of how they are assisting or not assisting East Harlem residents. So that's the plan. So as we move on the agenda, the district service budget consultations. I sent it out in advance. I don't want this committee to come to a meeting and be surprised as to what the agenda is. You know, Marlene and I meet beforehand, we discuss it. And then actually, as I said, I had an opportunity to meet with my vice chair. And so it was sent out in advance. I know folks have responses, so I want to just kind of set the stage in terms of like the what happens in the summer, and I'm going to say this, but what has been happening in the summer. So they're what they call these district budget consultations. This supposedly happens in the summer, July and August, where the agency folks are here, and they actually respond to our needs, our priorities. Each committee is coming up with questions and things that we're going to present to these agency partners. We're going to obviously, our committee is going to focus on the agencies that are listed, DOHMH, and that relate to human services. I think I can take a copy of this. So the whole idea is to have these things prepared in advance when we meet with when these folks are here. We have these responses, we have questions rather in advance, and they can respond to them. I'm going to be honest and say, I don't believe that we've been doing this over the last couple of summers. So we should really take advantage of like what the chair of the board is doing, and especially what Sage is doing in terms of being in charge of that committee he's in charge of, because he's doing a great job. We did the preliminary budget. We came up with things for that. This is the executive budget. And like I said, we have, I think, 20 items. I'm going to throw it out to you guys because basically there are some agencies that we've not heard from, or they've said we can't help you, or we can't, assist you. And then there are some that said yes, we can, and they've provided some information. So it's up to you if we want to expand upon those that we've heard from, or like say, well, why can't you, provide what we're asking for? Those that said no. So it's up to you. And then I would say that maybe there's a couple that are priorities. Chancellor, when I was speaking early on, and that's one thing that he's going to talk about. That's a priority that we should speak more about. Out and I've spoken, and even Leslie spoke earlier. So I'm going to throw it out to you guys in terms of proceeding. So what are your thoughts in terms of proceeding? Should we focus on those that we've not heard a response from? Should we expand upon things we've heard a response from? How do you want to tackle this? Let's start with the ones that we haven't heard from.
Okay.
And how we take the three and see if anything drops.
Okay. And we all
In terms
have
of information.
So we all have it in front of us. So is that the first one? Allocate. That looks like the first one, right?
The allocations,
Uh,
services for homebound. Now, we have numerous North
yes. We are in North. Yes.
in this community. There's Jefferson, Johnson, Gaylord White, Franklin Plaza. I don't know how many more there are, but I know there's quite a few in this Harlem. And they have been helping homebound older adults. I volunteer at the one in Franklin Plaza, so I'm very involved with what's going on there. But they have the Meals on Wheels, they come. And it's funny, just recently, beginning of the year, because of Meals on Wheels, his man was living alone, and he would deliver the food. So they saw him Monday, they saw him Tuesday, Wednesday the food was delivered. Thursday he went back to deliver the food, nobody took the food, and Friday we had to break the door down, and he had fallen. And since nobody was there, nobody lived with him. So we felt bad as North, because we want to be able to accountable for these people, especially the ones that live alone. You know, always checking up on them, making sure what's going on, making home visits within the complex. So, you know, when they're saying that there isn't enough, there is enough, but just how do we get more? There is resources there, we just need more. And in terms of the language, Franklin County is very diverse. So now we have Mandarin, Cantonese, you know, social workers there to help with the language barrier. And then we're trying to see somebody speaks French or Creole, and everybody else speaks Spanish and English. So I understand those needs are very needed, and we need somebody with a multi-language to help with all aspects. But North was one of them. Then with just basic paperwork that these people need. You know, North does a lot for them. A lot of people don't understand how much they do. I mean, even pay their rent, they actually help out with them. Filling out income affidavits, filling out food stamps, filling out just basic paperwork. So North is very instrumental, but they also do need more funding to expand the resources that they're doing.
So in this instance and other ones, as it relates to Department for the Aged, we have to emphasize, I think we wrote something worse to this, but we emphasize that this is a North. And the services that we need, so I would highlight that, like, that we're considered a naturally occurring retirement community.
Yeah.
And in terms of, and that's why we need these services, and as you're saying, in terms of just not just like Spanish, but expand upon the services as well. So let's formulate that into our question or response.
Also, the VNS, visiting nurse services, so
Right.
they're very, very good at helping out with just getting people to open the door and just check your blood pressure, that you're taking medication, stuff like that.
Okay.
Can I make a general comment? So anything that says further study, can we also ask for what is the timeline that they can provide for us, or a contact person, and like when they can, like, let's say 6 months, will they give us an update? Or like, we're trying to do something we can talk to them about?
Yeah.
This is for a lot of them that say further study.
Everything, yeah, we gotta tell these people,
Right.
so don't, you know, we're not asking, we're just telling them, so we want first, and we wanted, like, you said, identify,
Like the timeline.
timeline, and then
maybe
also,
a contact person
contact
or
people.
whatever.
Yeah.
I want to add on to that because that answer is very postmasters. I
Right,
went back and read the others, and there's always further study.
right.
So my question to them really is, do they even have the bandwidth to do a study? Right?
Okay.
And particularly if the CUs further study, while HRA and DOH likes to use further investigation. So I would like to know how are they going to do investigate into these requests, right? The words matter, and so if you stated that the study needs to be done, like who's doing that study, right? Are you actually going to be doing this study, or are you going to try to find a outsource it to do that study, and then tie that with what is this timeline, right? Really press on it, because I know how these answers are written. I know how they want to do it, so I like to see what that, if you press it against them using their own words, what does that look like to them? Yeah, that's just got on to that. And so, and then further, another question. I would like to see, I don't know, the board or even that committee, the district needs committee, I would like to cross-reference it with other community boards, and see their type of requests, because their type of requests are very similar to it. And they're also getting the same response, or they're getting an actual better response. And how can we fine tune it to make sure it benefits us?
I'm gonna say something, I guess, very controversial. I would suspect, I would say this, north of 96th Street, in terms of like community boards, so yeah, we should look at their responses, you know, it might be, oh, we're gonna do this, and then they specify what to do. I'm just saying that, when I say no, that things happen differently south of 96th Street, I mean like generally in terms of like just fair share in terms of services, so I would suspect the same would apply here, so that's a good point, yeah, I mean, this, I guess we can even, I mean, we can go through the budget committee, but we ourselves can go like any other community boards, like webpage or whatever, and look at their information as well.
What about going west? That can be the north restaurant?
That's
No,
not-
west side, not West Harlem, west
Oh,
side.
sure. Oh, yeah, sure.
You know, like.
Oh, yeah, so, yeah, not even, that, right, so not even like salvage, like, yeah.
Yeah, just the west
Oh,
side.
yeah, Upper East Side, Upper West, yeah, yes.
Upper west side.
Yeah, okay, specifically, yeah, oh, yeah.
Sixth Street, one
So
twenty,
bigger
that.
difference.
Yeah,
TV, yeah, okay.
I don't know what CB that is, but.
Okay. Yeah, so, to your point is that, yeah, we should like look at that. And that when we make when we have our responses, you know, it's with the information that if it can be done there, well, why can't it be done here? And there is something called fair share,
Right.
that, you know, and things should be done equitably.
So, I'm also curious, since, I don't know, us three right here, we're technically new members, you're coming back to this committee, how was it for the past couple of years?
In terms of the budget and
In
stuff.
terms of budget and these responses?
So yes, what I'm saying, for the past couple of summers, they've not met, they've not done this. So this is like getting back to what we're supposed to be doing and have these budget consultations. It wasn't getting done.
Remember the consultations, we did update the budget items every year.
So, we did update the budget. Okay. And so, have there ever been some success with it, right, where there is a.
Of course, oh yeah, of course. I mean, so let's not talk about the budget, the summer, things happens in the summer, that's, okay.
Yeah, there's
Just in
no.
general, yeah, just in general, yeah, so yeah, obviously there's been like improvements where or things have happened where, okay, that's knocked off because it was done. Oh, yeah, that, I would have to say yes, yeah, that's happened over the years, you know, that, we made these requests and they've been, they came to fruition.
While I am a big component of asking them the hard questions, they aren't coming to the meeting, so I don't want to get them all completely as well. So that's why I asked, just to,
Like the agency folks?
yes.
Okay, so when you say, so like our committee meeting, when we have like informational, well, we're working on that, because, you know, again, I'm gonna speak when, like, you know, when I was on the board 50,000 years ago, this committee, we would have our informational updates, so all the city agencies supposed to come and report or tell us about their initiatives and things of that nature, so we're trying to like get back into that. And obviously, you know, folks change, administrations change, so that's a factor as well, and I do wanna make sure I say that.
Yeah, and then, additionally, you actually, stated numerous times, they will try to accommodate this issue with existing resources. I would like to know, like, what is this resources are they like?
Yes,
And for the second one, also, I think it would be maybe important to ask them, what is the current rate that they have on homeowners exemption and disability insurance exemption, the percentage as compared to the percent of population that qualifies for it?
and you
so
still
that-
have the second bullet point.
Yeah, so then we can,
Yeah.
see what actually is not covered.
So that's the thing, right? This is a capital request. Right?
Yeah,
Would this be more of an expense? I just want to be clear, because, doesn't it provide money to like, for community outreach, because I know the state really controls how much the tax rates, but citywide, community outreach, that it's been just a misclassification, that
You're
it
right.
should have been instead of capital.
well, so capital really tends to like infrastructure, right, something
Yeah.
like of that nature, so if they're saying homo, but it's still, yeah. So it's like it's, all right,
Me,
we'll verify that.
yeah, because it
Okay.
seems like this could have just been a misunderstanding, of what we were trying to get from them.
But can I just say that, so that these 4 bullet points, the first 4 all relate to DIPTA, and we spoke generally about like, we're gonna emphasize North, we say North, But then we can actually specify, if you want more specificity with any of these bullet points,
Right.
let me know, but just generally speaking,
Right.
DIFTA, you seem to say, you don't have a response, and we're gonna highlight that in particular.
Yeah,
Too general.
yeah, it's really general, right, for a lot of these responses.
Yeah.
It seems like everybody's just giving their same copy and paste answer. And then they read through it.
And I think we were good about, like,
Being specific.
I was, what, you saw where I was going with that. What more do you want from us? So now it's like more like a general thing, and I'm gonna point out DIFTA, you need to do better in terms of like your responses to us. And again, they have a new commissioner, so, I'm gonna say that as well. So can we, say, so let's move on to, so we got DOHMH, next couple, right?
One of the agencies, the request, I was talking, this is the one I was talking to you about earlier.
Okay.
About the, providing access to the safe and legal syringe and legal drop-off boxes. Seemed like this was, the way it's written, it was misunderstood, they misunderstood what I was trying to say here. What I was saying, so in general, there's a state law that requires hospitals, nursing homes, senior homes, and some pharmacies to have safe needle injection, drop-off boxes, right? If you go to certain pharmacies, like CVS and Walgreens, you're not gonna see them there. The hospitals, Harlem Hospital, Mount Sinai, J. Carter, and Metropolitan, while they all have boxes, they're not easy to get to. And there's some type of barrier for it. And so we know, but as people drop their needles on the ground, a lot of times they're not gonna be the ones that will go to these spaces and just go past security to go drop off a recreational needle that they just use. Or even a person that uses a needle for medical purposes, they don't want to go through those barriers, or they work 9 to 5, so they gotta get on the train 2 hours early just to get to Brooklyn from here. And so by the time they get here, the drop-off center is closed for them. So the idea was for them to make a 24-hour public access where people can just drop them off, right? And they can be centered at safe locations, generally safe locations, like parks. Parks is already have a constant issue with needles in the parks. Which for the drop off box there, some in fire station, in front of a fire station, in front of a police station. So people just 24 hours to drop them off, however they want to drop them off. So this was misunderstood, and I just wanted to make sure that that it is reflected.
Well, in my opinion, the firehouses, they don't know how to deal with hazmat, situation, which are the needles. When diabetics and anybody that uses needles on a regular basis, they are advised to get either a plastic milk carton and put the needles in there so it won't perforate and it won't injure anybody else. If there's blood there, bloodborne pathogens, it won't spread to anyone else. So once the needle is used, they try to put it in a container that can be sealed and it can be discarded. These are hazardous materials because there's fluid and there's blood exposed on them. So it's very hard for the fire department because they don't deal with that to discard it. EMS has their own sharps, they call it the sharps container because it's needles. And they have them in the ambulance because they do administer medications to the patients in an ambulance, but they're very small and it's for that use, for that unit's only use. It's not something that they will go around and collect everybody's syringes, but they are red little containers that it's one way it goes in and you can't take it out. You can't break it open either. Those are the things that would be needed for these syringes because if it gets out, they wind up in the sewer system, they wind up in the beaches, they wind up in the pools, they wind up in circulation that shouldn't be.
For the current, yeah.
And, right,
Yeah.
and that's what's happening, you know, and it's become a hazardous to everyone. Even the animals, because they run across it.
Yeah, so I just wanna say, like, I'm not asking for PD or FD to handle it, I'm saying the site box be there. Because DOHMH already has contractors that they use to go and do, pickup sites, right? Sometimes they go through parks and they pick them up themselves, right? But it's not a constant thing. You can have boxes similar to like the post office does, and the compost and sanitation and composting and everything, they have people come who are certified, who are safe, who can take care of it. And so that's why I was the request to DOHMH, because they already have those contractors in place. It's just creating these spots because it's a more of a capital expense than a regular expense. So.
I have one comment regarding, I don't remember exactly on what point this is, but it's like the last one for Department of Health and Mental Hygiene.
What are you doing?
I just had a comment, like when they said it's completed for this one.
Can we?
Yeah, you wanna go each and every one?
No, that's what I wanna respond to it,
Yes.
So in terms of that, this particular bullet point, this is the fourth bullet point. I'm suggesting that we just provide more specificity and not, and I'm, with, this is my addition here, without like naming the other entities, because, that's where it seems like where the disconnect is, because we're talking about, if it's under DOHMH and then we're talking about parks and other entities, then I can see where they said, well, why are you asking us? So if we just focus on DOHMH and in terms of what you're asking of them, and if it's just that first sentence where it's provide the access, and period.
So that's
Or more to that.
So their first response to that, I remember from a couple of months ago, was that, this is a state law and these entities are already doing it. And it was just like, that's not the point.
Yeah.
That's not the point I was trying to,
Yeah.
the request was for. I understand that they are doing it, but they're not doing it sufficiently. Right? And it's not 24 hours.
Okay, so I think.
I can rewrite it and send it to you.
Okay, for that one. Yeah, thank you for that additional information. So now you're talking about what bullet point?
So for me, it was the last one that's for under Department of Health and Hygiene, where it says other programs to address public health issues request. It's an expense.
Okay.
Where we have the number of overdoses, in New York City and in East Harlem, and they say that this has been completed. I think we should push back a bit and say, what are the percent of social workers that they have, maybe for East Harlem or for these corridors, 103rd, 110th, 116, and 125, and what percent of the support has been distributed just to East Harlem, because they're saying citywide. So, if East Harlem has a higher need, does it mean that in terms of percentages, it's also higher?
Okay, so we'll just add.
Like, be a bit more specific with numbers. Because it's a lot higher in East Harlem.
Okay. So, I was gonna say, let's try to, kind of go through these in a little bit more of an order.
Yeah.
No, that's, because that's, so, so just, let's go back for a moment, we're on page 36.
Page 2.
Oh, 36. Yeah, let's go back for just a moment, the one's right after the diff, though, I'm sorry. DOH, so we looked at the destigmatizing of mental health needs,
You wanna go to vaccination? Is that the one?
yeah, I'm just gonna be fit, I'm just gonna be fair enough, so what resources and now vaccinations, completed. Are we okay with that response?
No.
Okay.
No.
Everybody okay?
The vaccinations have also come into play with people trying to just get help. And who shows up? ICE.
Oh, really?
ICE shows up at these little things. They haven't done it lately, but they have been showing up. They've been trying to get them out of the city, out of East Harlem, but they show up and just scoop people up just to get a vaccination. So now a lot of the community members here, migrant legal, illegal, they're more reluctant to go to a vaccination site. Now they've inundated, which is a good thing, Borinquen Health Center, because they feel a little bit safer there, and Borinquen Health Center has stopped ICE from getting inside. And they told them, no, you can't come in here, you know, with their mask on and everything, it's like, no. So people kind of feel like a safe haven there, but in other clinics, I don't know what's been happening over there. So when it comes to the vaccination, you know, people are like, I don't know. You know, I'm not documented, so I don't have this, I don't have that, and they're more reluctant to get their child vaccinated until something happens to them. As
So can I, as a friendly amendment or based on what so the response is, is their response, so in terms of more, in terms of how they share information, and if you want to add wording to the effect of that, you know, this is a safe space, or you want to, I don't know if we're gonna put that, like, you know, make sure ICE doesn't show up at UHMH. So something to the words, the effect that, you know, it's, you know.
they have to make it a safe haven. for
Right, so that,
patients.
so, yeah, so, cause, I mean, so in their, so they're saying they're doing this, or they're to be completed, but they're also saying that they can, you know, agree to, like, you know, again, provide more information and education, so we can add to that.
Right, what they shared.
Yeah, that, you know, this is a safe space, but, you know, I don't know how specific it can be about when we can't. So, but it's like a safe space. We can do that. How's that?
Yes.
Yes,
Okay. Okay, good. The next one
and
is,
maybe also more specific again, they're
More
very
specific.
general in terms, they say it's been completed,
Yeah.
but like what percentage is actually been done in this department?
percentages. Okay.
Whooping cough is a child, it's that's more like newborns,
Yeah,
younger, but you know, it's not a, it's.
But you can't-
but especially if they are undocumented, they're gonna be scared.
Safe space,
Right.
It's enough.
You know, measles, thanks to.
And then it'll spread more.
Yeah.
Alright, so the next one is, create or promote programs for education, awareness, preventing chronic diseases. Okay, and they're saying, we'll try to accommodate within existing resources. We can have them be more specific about what try to accommodate means. And what's stopping them? What is the challenge there? It's a very, you know, direct and
Goes to family
doable
healthcare.
thing.
This goes in towards family healthcare. You know, it really bothers me when we see the father vaping and holding the kid with an asthma attack. And it's like, why are you smoking with the kid? Or they go outside, have a cigarette, but their clothes smell like an ashtray. Oh, but I went outside with the closed off gas, the smell triggering the child to have an asthma attack. So this is the things that have to be reiterated and educated to the family so that they can understand it has to be a clean air environment for the child to breathe easier, better. So with that,
Have to be exposed to.
All right, so you're jumping, you have the bullet point third to the bottom?
you
She's
said the,
create or promote programs for.
So talk about, okay, oh, so, you're talking about asthma,
yeah,
okay,
that's the one.
okay, so asthma was quick smoke, okay.
Yeah, so the family has to be educated. As well.
Specific, and then, education in terms of, education, family members, more education. Okay. Sorry.
Or can the Department of Health provide this education if they give, I don't know, insurance, or they have to apply for some medical, I don't know if this can be incorporated, so
Yeah.
now at doctor's offices or.
We tell them, you know, if you say, you agree to provide education.
Education, tell us where.
So same thing could be said here as well. And you're saying specifically what again?
Maybe in doctor's offices, or like, you know, when they
When
apply
they
for
go to their
insurance.
pediatrician,
that
when
This
they-
information should be shared.
or if they wind up in the emergency room, and they feel that that's their clinic, that should be reiterated there as well.
Okay, so the next was,
We did the
okay, we
next
just
one,
did
yeah.
That's-
Asthma, I think it's the same.
Yeah, I was gonna say, that's why I thought. Yeah, so further investigation to arrests. And then other programs to address public health requests. So we're saying fund community and Zoom literacy programs, embed literacy schools. Okay.
It's just sad that this community is going under such heavy construction and just making the air quality worse.
Oh, yeah. Well, I mean, yeah, just in general, these homes are, yeah, like lack of trees. Or infrastructure. Let me see something, it's the further investigation. Programs.
We're doing the Rat Academy.
Yeah, yeah. All right, so then the last bullet point, yeah, right, so yeah, they got the Rat Academy coming, so. Well, you know, I guess for this one. Yeah, well, I will add, you know, that based on DOHMH, you know, we spoke to them and and they have a Rat Academy. Have you ever had one in East Harlem? No, well, then let's have one in East Harlem. So based on that, you know, they've done that, which is good. So it's us telling them, you know, you have these resources or these services, you know, make sure they make their way to our community. So I would probably say that the Rat Academy is taking place. I'll add that. But more can be done in terms of, right? So, okay. I don't know why they didn't suggest that, you know, that we have a Rat Academy and we could. We'll okay with that one? It seemed like they could have suggested, I mean, we have these resources and, you know, one, you know. So on the next page 4, the first bullet point, okay, so supports the position, complete, did we do that? Yeah.
Yeah, read that.
Domestic violence. So now we're HRA. So 1, 2, 3, 4, there's a bunch of HRA, 4, 5, all the rest are HRA. Except for I think the prison, yeah, all right, HRA, what are they saying? Domestic violence, okay.
The first two is basically saying the request has been completed, and they support it, and the request has been completed.
Yeah, actually, a couple, yeah, the next one as well.
Yeah.
So, okay. The next one as well. It's, okay, completed.
I think again, we should ask for numbers.
So
How many?
numbers, so for all, even when they say it's completed,
Like, how many
numbers.
East Harlem?
Numbers, East Harlem specifically, okay, good.
Well, that second one is more, it's talking about modifying eligibility criteria. So,
The vouchers?
what, in their response, they didn't tell us what the eligibility criteria changed. So I guess we need to figure out what is that, like, what changed.
Okay.
That's what we requested.
Mhm. Criteria, okay, more information on criteria of a change. All right, got that one. And other domestic violence services. The second, last 2 bullet points on this page. Other domestic violence services requests. Provide housing assistance, domestic violence. Okay. HRA. Okay. So, you know, it's interesting in that the one of their first bullet points, they talk about defer to the mayor's office to end domestic and gender-based violence. That's nice to refer us to another agency, but for this, I know.
Can we request a meeting with them so they can actually,
So that's the point of the summer thing. Oh, I don't know, yeah,
oh, like for them to come and
yeah,
present?
that's where it was, that's the whole point, it's like, you know, we want.
Okay.
Yeah, so for this one, the last 2 bullet points, of the domestic violence one, that's kind of similar, or,
Yeah,
I mean, in terms of the general topic of domestic violence. So we'll bundle those 2. And then the last one on this page, other services, vulnerable New Yorkers, LGBTQ plus, very important.
Yeah,
What are these?
then you guys further investigation.
Oh, wow, there's a Okay, so you know what, this is a lot, you know, so this is one where I'm gonna say, what more do you need from us in terms of making sure that, just generally speaking, folks that are LGBTQ plus feel safe and there's enough services available. So yeah, that's gonna be a problem.
Well, Metropolitan has a whole wait.
They have, yes, they have their, yep, they do. They do,
They just had it on last Tuesday, Friday, in the parking lot, really big organization, really big turnout.
I went last year. Yeah, they do, yeah, Yeah, so that's Metropolitan, well, but, so this is speaking generally in terms of services. We can point out that Metropolitan has something, but outside of that, what else? And then also just in terms of like, do folks feel safe? There's, we say substance use issues, concerns, housing, it's a wide, I mean, it is a lot here, so I don't know why you need further investigation.
Well, Mark Levine, when he was a borough president, he sanctioned off an empty lot on 106th Street for a building only for LGBTQ residents.
Housing.
Yes.
Oh, right.
Yes. He did. They haven't broke ground, they haven't done anything, but it was sanctioned for them, and that was it.
Well, then we should follow up with that. But HRA, Resource Administration, you need to provide us more information than further investigation. Because we're asking a lot here, so we can, this is a horrible and inexcusable response. So, yeah, more for that. And other requests.
And it says contact the agency, so.
Contact the, okay, yeah, we will. Okay. Other requests for Baltimore, New York is migrants, East Harlem. Okay, so language access services, again, we're spelling this out to them. East Harlem is a significant increase of migrants. So what do you need here? Oh, okay, it supports the position.
Want a map?
It supports
Give me the address. I think it's hard,
Maybe
maybe
we
we
can-
can, if you're too specific, they're like, this is too specific, then if you're too broad, they're like, be more specific. So it's like finding that spot that only they know where that spot exists.
Can we get eviction rate for East Harlem? Eviction rate, like, the one that we're asking for support of, housing assistance, for example,
Okay.
for these, either like immigrants, population.
So it's about, you're taking.
Yeah, and this one,
Yeah.
like,
But-
like,
well, I mean-
like, what are they asking? Maybe one of them is an example.
Okay,
When we're asking for housing assistance, we can say these are the eviction
okay,
rates.
so we can give them more
Like,
data?
yeah. Yeah, I don't know if we can get that information, but, right.
Yeah, oh, yeah.
There may be an open data.
Yeah, oh, yeah, right, yeah, I'm done. So then the next one, HRA, funding for group representation of tenants.
Yeah, I don't know what that is.
Tenants, why is that with us? That's not us. That's housing.
The city one.
Yeah, let's,
Cause we put it in the context, I think, of them.
Dramatic crime, Venezuelans, Honduran,
Yeah.
Haitian asylum seekers. They need a map, that's what I'm saying, they need a map for
which
this.
one is it?
Yeah, she's discussing this one, like, the same.
That needs a housing
Oh.
support.
Oh. All right, so, I mean, it's,
I think maybe because we mentioned language barriers, legal representation, all of that. But,
we could, I guess, we could, there's a lot there, so I mean, at least there's could be some response to whatever, applies to them, I mean, rather than, well, but none of this is, we need more information over, we support the position.
Right,
Okay.
switch it out and see where it lands.
All right, here's all we got in terms of time, everybody, so, expand or enhance emergency food assistance program, further study. To expand the program, why is that, growing number of East Hall residents who are food insecure? For the study, I don't know what we need for study. I think we were very clear about what we're asking for, there's some data there.
Supermarket, I'm like, yeah, we can open that, that's the study.
Okay, give me 1 second, so we are.
$30 million.
Food assistance, we wanna throw in there about with that coming. We can throw that in. On our camera. Let's throw that in there. And then, other requests, other last ones. Other requests, are you asking for me?
so maybe we can ask also again for timeline here, because it's a further study by the agency is requested, like how long will it take, even with the Marquette, the ratio 1:17. It's not gonna change as much with one more store opening, I mean. Somewhat, but not.
All right, so what was the last one though? caseworker availability. Oh, this is very good. Sorry. They're saying. Okay, it's like response. Language. We're missing some, the response. Oh, no, we did. Oh, okay. Same thing, well, if they're asking for more information, we'll provide. We'll ask.
Statistics and everything.
Yep, stats, okay. All right, is that it, everybody? I've been taking notes.
Yeah.
All right, good job, everybody, good job. So let's finish up, everybody. Great job, everybody. Appreciate everybody's thoughts and opinions. So just the last one, should not take road, we're just talking. So I just wanna, you know, when I send out these, when the agenda goes out, right, I have announcements and there's things that are taking place in East Harlem. And when members can attend, that's great. So I just I wanna highlight that members have attended, so, one of which was, Volunteers of America. They have a Schwartz, they have an advisory board. Otto was on the Zoom, I was actually working at the time, and she actually, had some notes and some,
Yeah.
and this will require follow-up.
Right, yeah, we discussed with Jules, maybe we can invite them to give a more thorough presentation here, but basically they mentioned that they have, 2 shelters in North Island. And it was established in 1984. They have 220 beds for the general population, 18 and above, and they have 65 beds only for mental health dedicated. They went through the screening, it's only for men. They have an application referral as well. The intake happens at 8 East 3rd Street, and the evaluation hub, it's in 3 different locations. And 30th Street, Bedford Atlantic Assessment and McInnes Assessment. So then they go over it, how they help them with, not just medical, they also provide education and employment assistance once they're enrolled in the shelter. They also provide other services based on individual need and experience for each individual, and also they try and help with housing assistance. That was kind of the general idea, going over it quickly. They also have 24/7 security on site, private, and they expect everyone that goes there to respect and adhere to the shelter rules and regulations, no alcoholic beverages, no weapons, no stealing. So these were kind of what they expect from the shelter. So that's basically like an overview. I'm not sure if I'm missing anything.
That's good. Yeah, so,
Yeah, they provide, as I said, medical referrals, and that's for NYU, so that I thought was pretty good.
and so the plan with this, they plan to have this CAB meeting, I think quarterly, I'm full of hand. I think this was like the first, so, and the whole point was just to kind of like introduce their services, and I'm looking at the agenda, there was a presentation, then they had opened the floor for like, community concerns. Were there a lot of concerns, what you said?
It was more like general questions in terms of like, okay, what kind of medical assistance, how do you follow through, like with housing and like social workers?
Okay. All right, anyone familiar with this entity, and these services that they provide, by the way? Saxon.
So Volunteers of America.
Yeah, and then, but also like specifically that, this is on boards.
This was established, yeah, in
On both sides?
1984. And initially they had 4, then they went to 3, and now they have 2, so let's hope they don't.
They don't have members over there?
No,
Yeah, so we will,
or
hopefully
you can raise
attend
that, I think as well.
and attend, and regularly attend, so that was like, I guess, the first of, like I said, there, that was.
Excuse me,
Yes.
Jules.
Yes,
They've actually presented to us numerous times.
okay, so, but this is like.
The shelter itself.
Okay, so this like, they have a cab now, so I guess they formed this cab. So that's what we wanna make sure that we attend, like the cab meeting, this advisory board meeting, but thank you for saying that. Yes, and then, so Robin, were there some offhand you recall, any questions or concerns that kind of like jumped out when they came to present? Or even like when we asked about the women's
It
things?
was, there were occasionally talks about expansion, which of course, because of the moratorium, was a concern, you know?
Okay.
Right? So,
Yes.
I think at the time all we could ask for was, can we have a presence on your board?
Okay, so then, look, this is good, so then now we have the form this advisory board, and we will. So I would say that, you know, if in past presentations, or if you have questions or concerns, the next time they have the board, we will come with, like, the communities or the committee's concerns, or we'll have some stuff available, to questions for them. Thank you for that.
And I remember they specifically said that if they need more information sessions, they're happy to provide it.
Okay, that's good, that's great. Thanks, Robin. Excellent. And then I just want to just briefly mention that I attended this, the New York State Health Department had this Stronger Together Community Action in Times of Crisis, Emergency Network Conference. So they had like members of the COAD there, the East Harlem COAD, but other emergency, actually all the COADs. So there's a COAD in East Harlem, there's a COAD, and they also Staten Island folks. They talked about emergency management and stuff like that. And then the last thing, I want to thank Leslie for coming to Citizens Preparedness Training at Gutman Community College. And any thoughts about that?
I think it's fun. No, it was a great presentation. A lot of people should be considered to attend one. We should have another one here in Spanish Harlem. People don't understand like what would happen in case of a fire, in case of flooding, in case if you have to, you know, exit your residency on a whim.
Right.
Then you start picking up things that you don't believe. This presentation was very narrative and very streamlined to what is needed in case you have to evacuate your house in case of an emergency and what to take.
Yes.
Don't take your favorite blanket, don't take your favorite shoes, you know, don't take your coat. You have to take your documentation, your papers, your insurance, money, any insurances for the house, your medical insurance, your medication,
Yes, yes.
Children.
yeah, your pets.
Yes.
I mean, they gave a nice, very thorough, detailed presentation, and it's basically geared to elderly. And the one thing that people don't understand is that these elderly people, they go to the hospital, they don't take all this stuff. So when they get there, they're like Jane Doe or Julia Doe. They don't know who they are. But if they have this go bag, when they have to go to the emergency room, everything is there. You know, what they're allergic to. Some people don't even remember what they take, but it's written down, the medication that they take, when they take it, what they're allergic to, what can they take, emergency contact. Very, very detailed presentation.
Do they provide any feedback on, for example, like, I know someone who it happened at my job, like, you don't go on the rooftop if you go through the staircase or something like that, or it was just what to take?
It's what to take, yeah, what to take. You will learn the emergency egress, access in case of something, but just what to take.
Yeah.
Have it ready.
Was it on Zoom?
You can have it on Zoom, but what they give you, everything is hands-on.
Yeah.
So a portable battery,
I see.
you know, gloves, a flashlight, a basic flash. People don't think about it and say, yeah, if the lights go out, if we have another blackout in New York City, you need a flashlight. Gotta get around.
Can I tell you about that? When she talked about that, remember she said we all have like something on our phones, right?
Yeah.
I do plan to have her come back. And I actually went out and got this, because, you know, just think, you need to have portable. So this is actually, I actually got this. So this is like a flashlight. And rather than, if this, you know, you don't want to waste your battery on your cell phone, you have your little miniature one. So actually, that's one thing I learned.
Yeah. You have to
And
have
they give you the go bag with a lot of stuff in it. So that's a bonus as well. But I do plan to have that back at my place, but East Harlem, we should you know, have a site and have them come and give up. I mean, they've done that before.
They've done it
Yeah.
at 71 East
Yeah.
21st Street,
Yeah.
all we need is to get at least 50 people.
That's right. That's right.
Put it on our community board,
Yeah.
Website,
Exactly.
let people register, and they'll come through. Very, very informative.
Thank you for coming. I appreciate that. It was a good well attended. And then lastly, I just want to, for the record, I want to say that I had put on the agenda that Miss Ayala from the Department for the Aged I had sent an email. I requested from her a list of the older adult centers, and she finally sent that on May 21st. I forwarded it to you guys because that constituent requested information. So she finally sent it. So we have all the things listed there. There was one thing I did ask about the legislation, and she had a follow-up question. And I'm like, everything that I wanted was in my email. I'm not trying to sound harsh right now. So, you know, if you have information about what I provided to you in my email, that's what I want in terms of a response. But I do appreciate the fact that she sent the response in. And just for you all to know, Dr. Rowe, who came last time, had asked us for some information. So I just want to, you know, and Robin was one of the main people who I think was providing some sites and things like that. So if we could kind of compile some of the information, and please look at our minutes in terms of what she requested. So I'd like to get back to her and provide the information to her. That's all my old business. Any old business? Anyone else? Oh, Robert, yes.
Hi, this is a follow-up to the information I provided that allowed us to do a resolution about SCREE and DREE, actually a letter in support of a bill that went through the state. And in fact, does everybody know that the ceiling for SCREE and DREE was raised to $75,000, which is amazing. It's historic. But as
Excellent.
a follow-up to that, through the community board, I've been involved with the Center for Urban Justice, which is basically what used to be Housing Court on East 121st Street. And they're very excited about this. I'm now on a committee with them and the oh gosh, the League of, you know, the lawyers.
Yes.
I can't think of their name. It's just so escaped me. But we have a plan, and we're going to have an event sometime in September or October, either at that site or something larger, depending on how many people respond, to help people complete the form so that they can actually enroll for SCREE for the first time. This really impacts only people who are living in apartments that are not rent controlled, but rent stabilized. And if you recall, the statistics at that time said that in East Harlem, only 27% of eligible apartments had applied for that benefit. So you can imagine, by increasing that ceiling to $75,000, how many more people are actually going to be eligible. One of the reasons I'm raising this is they're looking for volunteers to help the day of the event. It's not the Urban League, but you know who I'm talking about. They will train people to help people fill out these forms. Anybody who wants to come will be asked to bring documentation with them, of course, their rent information, their social security letter, etc. So we can really, in just half a day, help a lot of people have a better quality of life and remain in East Harlem. If anybody would like to help volunteer with me, I'd be happy to connect you at the time. So thank
Why don't you
you.
send all this to me and send it to us in an email?
I will be happy to.
Yes,
and I'll
of
have the
course.
actual names of involved. Sorry. To me, it's late at night. Sorry.
I hear you, brother. Yeah, so it sounds like something we should be involved with, and I appreciate you being involved with that. And please keep us posted in terms of your involvement as well.
I will. Thank you.
You're very welcome. Any new business? I guess let's call that new business.
New business, just something for, I guess, for the fall, just to keep it in mind.
Mhm.
If we can use the federal funds that each committee has to do something to benefit the community.
Sure.
Because, you don't use it, we lose it.
Yeah, sure.
So, it's $500, I think, I
Yes.
remember that.
Yeah.
So I think something that we to think about over the summer is how we can actually utilize that.
Yeah.
If anybody stays with the same community.
Yeah. And just so you know, in the past, this committee was called like seniors, health, human services, et cetera. And then in the past, there was like, I'm just throwing this out there. There were like, we had like a senior, Robert probably remembers, senior like
Immigration.
Immigration, right. So it was like 5 different things. So if you want to like focus on one, it's up to you all, and have like I don't know, a conference or whatever you want to call it, and you use the funds. Happy to, it's a lofty thing to do, and it's been done in the past. So happy to do that. So let's think about some stuff like for the fall, everybody. Let me come back after our hiatus. So as you know, this is our last meeting, right? Thanks everybody. Hopefully some of those 10, one or more of those 10 new members will be part of this committee as well. I hope so. So that being said, any other new business? Otherwise, roll call.
The game started.
All right, I guess it's roll call time.
Leslie Cologne, President. Honorable Meeting President, Chancellor Greg,
President.
Bill Jones,
Present.
Jennifer Meyer.
Present.
Tanya Phelps,
Present.
Valerie Ponte, absent, and Robert Station.
Present.
So thank you all. We are adjourned at
8:30.
8:30. Thank you all. Have a great
Be
summer. I
well.
guess. Yes, we'll see some of you on Friday, hopefully at the orientation thing, whatever that